This is One-on-One. We are pleased to be joined for the first time talking about oral health with Dr. Cynthia Jetter, who is a general dentist. Good to see you, doctor.
Good to be here, Steve.
The term periodontal disease, what is it and why should we be concerned about it?
Periodontal disease is a fancy word for gum disease. And gum disease in its earliest forms is as innocent as maybe a little bit of blood in the sink when you're brushing your teeth, and it runs the gamut all the way up to your teeth are loose and there's pus between your teeth and they're coming out.
Okay, so let's play this out a little bit. That's probably happened to countless people in our audience right now. At what point does that little bit of blood, okay, become something we need to be worried about? Because say you're flossing, you brush your teeth, I see the blood there all the time, a small amount. When do we say to ourselves, wait a minute, I need to get this checked out? Should there be no blood?
There should be no blood,
Oh,
ideally.
is that right?
That's correct.
Wait a minute. So no blood is what we should be going for. And by the way, the reason there is blood is why is that?
Well, bacteria in your mouth cause inflammation, and it's the inflammation in your gums that causes the bleeding when you're brushing and flossing. So as soon as you see some blood in the sink when you're brushing or when you're flossing your teeth, that's probably the time to see your dentist.
Is that right?
Yes.
So it's not even the amount of blood, it's any blood.
That's correct.
Okay. And the reason, let's be clear, because as we were doing research for the show, and we did a roundtable about oral health recently on our sister program, Caucus, New Jersey, and I was really taken aback by the fact that there are other diseases, other serious health problems that are directly connected to periodontal disease. Let's break these down.
Yes.
What is the connection between periodontal disease and diabetes?
The inflammation that occurs in your gums and in your whole body from periodontal disease has been shown to be linked to a greater risk for diabetes. So when you take care of any kind of gum disease that you have and treat gum disease, you're really going to impact your overall health. Now, if you already have diabetes and you have gum disease, if you don't treat your gum disease can actually make it more difficult for you to keep your blood sugar under control.
Okay, so it can get worse?
Yes.
And what about the cardiovascular issues?
We believe that the inflammation that's caused throughout your body from periodontal infections is linked to cardiovascular disease also, and stroke.
And stroke.
Yes.
So if someone says, well, it's just my teeth, my gums, they're wrong.
Absolutely. Everyone wants healthy, beautiful teeth.
So it's not just a cosmetic issue. Be clear on this.
Absolutely. It's not just a cosmetic issue. We all want a beautiful smile. But good oral health is actually more important than what we have previously thought because of the association of these greater systemic diseases with gum disease.
Now, the other thing that we were talking about right before we got on the air is pregnant women are and if I'm wrong, you tell me this, there's some potential problems if a pregnant woman has an issue with periodontal disease. There could be potential issues regarding low birth weight babies.
That's correct.
Why?
Well, some studies indicate that there is, again, an association between the inflammation in your gums and preterm birth and low birth weight. Some studies have indicated that treating that periodontal disease during pregnancy may not improve the chances of decreasing low birth weight babies or preterm birth. In actuality, it may be more effective to make certain that your gums are in optimum health before you actually become pregnant.
So let's talk this through. Give people some concrete advice. First of all, how many times and how often do we brush our teeth? Should we?
Ideally, we should be brushing our teeth at least twice a day for approximately 2 to 3 minutes at a time.
2 to 3 minutes?
Yes.
Not the 20, 30 seconds?
Absolutely not.
Because?
Because we want to remove all of the bacteria and the plaque that form all around your teeth and gums, because that is the beginning of the gum disease.
Okay, and so get the camera on me, Bob. This, for 20, 30 seconds is a problem. Is talk about more about this. Why is this better? I've heard this.
When we use a circular motion,
Right.
it actually is more effective at removing plaque from in between the teeth and at the gum line, because not only do you want to clean the teeth, but you also want to make certain that all the area around your gums is clean also.
And the flossing, how often?
At least once a day.
At least once a day?
Yes.
After meals? But nighttime, daytime, morning, what?
I recommend at bedtime. You brush your teeth, you floss them, and then don't have anything else to eat or drink after that. And you may get the most improvement in your oral health that way.
Genetic issues here? Like if your father, mother, relatives have oral health issues?
Absolutely.
Wow.
There are some people who are genetically predisposed to disease, to gum disease, and even though they stay on top of their oral health, they may still suffer from gum disease. But with the extra effort that they put into their oral hygiene, they can keep the disease at a minimum.
Quick question before I let you go. Why did you choose dentistry? Why do you love it?
Oh, I love being a dentist. I love helping people restore their teeth to health, have a beautiful smile, and see people gain back the confidence that they lost when they lost their oral health.
You make a difference in people's lives.
I try to.
Well, you've helped a lot of people today. Dr. Cynthia Jetter, who is a general dentist from Voorhees, New Jersey. We're all the way up in northern New Jersey. I want to thank you for coming all the way up to our studio here in Patterson to be with us and share a lot of important information about periodontal disease, oral health. We thank you so much.
Thank you for having me.
Stay right there. We'll be right back right after this on One-on-One.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, Wells Fargo, Delta Dental of New Jersey, the Russell Berry Foundation, Felician University, New Jersey Sharing Network, and by Virtua. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.